let's talk about some misconceptions about detoxification. So a lot of people talk about these teas that they find and different juice diets and whatnot. There's so many different things out there, clays, and whatever. And some of them are really great and work. But why are you doing it? And what are you trying to achieve? Just because liver detoxification sounds like a good buzzword or something good to do. And there's situations where, yeah, I'd certainly agree with you and say that it probably is safe. And there's situations where it's actually potentially dangerous. So let's talk a little bit about that. So for those of you who are in pretty good health, you don't have major symptoms, you're on the young side in general, under 30, a lot of these teas and whatnot, as long as they're good quality, probably, and I don't know them specifically, but they're probably not a terrible thing and very unlikely that they're going to cause any problems. That's in the situation where you're actually in pretty good health and you're just supporting the body and doing what some animals around the planet do, which is a yearly or seasonally detoxification. There's all sorts of evidence in nature of different animals, elephants and different types of fish and even other animals doing different behaviors to detoxify the body, and that's a yearly or seasonal thing. But for those who are experiencing symptoms, detoxification can actually be potentially dangerous and harmful, and certainly quite uncomfortable. And why is that happening? So for those people who are experiencing more significant symptoms as a result of detoxification issues in the body, which don't just have to be the liver, by the way. We have the liver, we have the kidneys, we have the lymphatic system, and the adipose, the fat tissues of the body. These are the major areas that deal with toxicity. And that toxicity, when you go into a detox, it doesn't just poof into thin air. You don't just pull it out of the body. It has to go into the bloodstream in order to exit and then hopefully be processed by the kidney and excreted out in the urine. Depending on how much toxicity is in this body, how toxic it is, how quickly the body responds, which sounds nice, but isn't necessarily, but how quickly the body starts to detoxify. What if this body just starts dumping toxins out of the liver into the bloodstream really, really fast? Theoretically, that sounds nice, but you just poisoned yourself. You just put all this poison from inside your lymphatic system, the fat tissues, or the liver, and you dumped it into the bloodstream, and it can be really uncomfortable. And in some cases, we've actually seen it actually aggravate people and cause new problems. And sometimes those problems don't want to go away so easily. So certainly in the situations where we have people that have more significant issues, this is really something you want to do with a experienced functional health specialist, someone that knows what they're doing, knows how to actually avoid these symptoms and knows what to do. You don't just, for example, if you wanted to pave a road, you don't just start dumping asphalt and drive a steamroller over it. You have to make sure the ground is appropriate, there's no sticks and rocks, and it's engineered properly, and do studies. You have to make sure it's right before you do that last step. And detoxification is a situation just like that, where we have to make sure someone is ready for detoxification. I want to make sure, often I'm trying to help people improve their digestive system. That's another area that your toxins actually dump into. The liver dumps toxins through the gallbladder into the digestive tract, and if you have pretty significant digestive symptoms already, like heartburn and reflux and IBS or colitis or Crohn's disease, this is going to be a big no-no. It's going to cause a lot of problems. We have to fix those issues first, and then very carefully and gently, if necessary, do detoxification. The first thing that we're often dealing with, and I'm not suggesting people do this at home, but the first thing that we do is make sure the kidney function is appropriate. This is both through signs and symptoms. How is the patient's urination just operating? What's the color of the urine, the frequency, to blood work. There's different tests in the blood work that can show that there might be some kidney trouble. Little sneaky symptom is back pain over here in the area of the kidneys. If people get that, that can sometimes be a sign that the kidneys are having trouble. Also, dizziness, nausea, and even headaches, and swelling, especially in the legs, can be signs that there might be some kidney deficiency or weakness. The kidney itself, to me, is the most important first step in assessing detoxification potential and safety in someone. It has to be working. The kidney system has to be working in order to deal with the liver and the lymphatic system first. Otherwise, it can get really messy. Now, what might you feel if you had a messy detoxification? So there's a couple names for that experience. So people call it detox symptoms, detox syndrome, going through a detox, or even Herxheimer reactions, which is the name of a doctor who first described this in depth. And what those are is literally, as you're detoxifying, taking the poisons out of wherever they might be, the liver, the kidney, the lymphatic system, or the fat tissues, and moving them into the bloodstream, you're actually literally putting poison in your blood, poisoning yourself. And if your body can't keep up with that, for whatever reason, you're going to feel it. And most commonly, you would feel tired, achy, maybe headachy, out of sorts. But it can be pretty intense, and other people can actually get flu-like symptoms. And when I say flu-like symptoms, I literally mean anything. It's actually the same reaction going on in the body where the immune system sort of freaks out at what's going on. And you can experience everything from a slight fever to a skin rash to nausea. I've even heard of people vomiting. It can be pretty wild if it's not done appropriately. We really do everything possible and not allow this stuff to happen in our office. We're assessing the situation, making sure the person's in the right shape. And there's actually some really great techniques to mitigate these things from happening, different binding agents and whatnot that can be used if need be. Detox is not always such a benign process. Again, for people that are in great health, that are not really having issues, your store-bought detox tea probably isn't an issue. But for those that are having more significant health issues going on, this is really not something you should be doing alone. It can be really not a great process. I'm not saying you shouldn't do it. It can be amazing if done properly. Don't get me wrong. This is detoxification, and helping the detoxification process can be ultra critical in the success of your health, improving your health. But it really needs to be done with someone that knows what they're doing and has a lot of experience with it. And just watch out. There are some doctors out there that like to detox people and actually make them sick on purpose so they can go, oh, wow, look at that. It's working. Absolutely unnecessary. I avoid that as much as I can in my office. We do everything possible to make it the smoothest, lightest, easiest detoxification possible, though in the end, ultimately, the deepest and most thorough. I hope that was helpful for you. There's a lot of topics in this with detoxification. It really can affect almost anything in the body, but it's really not a first step for most people, especially if you're having any significant symptoms. We don't want to start with detoxification. It can really end ugly sometimes. It's not worth it. Find someone that has experience managing these things, and it can be a very easy and smooth process.